At about the 5-year mark in the history of the Nova Scotia Health Authority, the interim CEO, Janet Davidson, made a major shakeup at the top last week, removing 3 senior vice presidents and making a directive to put more medical and financial control at the level of the 4 zones.
Right, and frankly, I feel like we should be stepping out of a DeLorean here, because there is a real Back to the Future feel about this, where when I started thousands of years ago, when the Earth was just cooling, we did have 4 regional health boards, and they were autonomous, and they were about delivering health care locally with an overarching control by the health department. Now we have the same sort of structure, except at the top of the food chain is the Nova Scotia Health Authority.
Right, and one of the differences in having that health authority at the top of the food chain is it does ensure some provincial consistency for things like program design and rollout, recruitment, doctor recruitment and retention, nursing recruitment and retention. Purchasing power would be another one. And let's also call a spade here. Having the Nova Scotia Health Authority to oversee this, as opposed to the provincial health department, gives the government a little bit of cover and distance when it comes to having to face the heat about the way the system is designed. But what we have to now wait and see is whether or not these changes do what they are intended to do, which is address regional concerns that they're not getting the level of service that they need.
Yes, healthcare is a complex structure. Delivering healthcare can be messy, but what I don't get is, for forever tinkering around the structure, how does that actually improve patient care? How does that help the guy who needs his knee scoped? How does that help the woman who needs a pacemaker? We need to see that whatever they do up here actually translates into real changes at the bedside.
That's right. And Janet Davidson said one of the issues with the health authority as it existed before last week was that it was overly burdensome and complex and cumbersome. And so sometimes people at local levels were really having difficulty being as nimble as they needed to address their needs that may have differed in one part of the province than another.
Which is crazy. It's crazy.
Right, and so that's why these changes have been made. And you know, with an election not that far on the provincial horizon, a year, maybe 2 years away, it's a safe bet that the Liberal government is hoping that these changes and any others that get made result in tangible improvements to the healthcare system, and it's something that they would be able to campaign on.